Okay, well, I mostly want to just talk about two models of how this information might have an effect. I'll dump on one and then be a little bit optimistic, contrary to character, on the second. So the one that I'm going to dump on is the passive model. So this is an idea of, well, just if we can get information out there and what works and what doesn't, that's our job, and that'll produce enormous benefits. So the idea is that better information for providers, and maybe for patients too, although bringing them in is something I'll talk about at the end, might cause people to change automatically. I mean, it would be beautiful if that happened, if sort of discovering what works and what doesn't caused physicians to change behavior toward the more effective treatment without any stimulus. You can probably already tell I'm not anticipating that's likely to happen, but it could happen. We can always light a votive candle and say a prayer. Why it might not is not only because, like the rest of us, physicians tend to be stuck in their ways, or people tend to be stuck in their ways, but there is at least a kind of economic theory called the value of information, which essentially says how much you're willing to pay for information depends on how likely you think that if you have that information, you'll make better decisions than if you didn't have that information. You need to get a PhD to think up that theory, but that your mother could have told you. But the sort of implication of it is, if people aren't seeking information, maybe they're not going to, they wouldn't be that likely to change their behavior if it showed up. Because if it would have made a big impact on their behavior, they would have already gone out and got it. So that's, again, kind of the premise here, that, again, we may hope that it works more effectively than this, but a reason to be skeptical, above and beyond, as I said, just a sort of general theory of inertia, is that, you know, if this was really that important, somebody would have already found it out. I mean, I know that got Pollyanna in trouble, but there's still some truth to it, I think. So it is best if people do the right thing, but I don't think we have very strong evidence. In fact, the sort of oral tradition at Penn is providing evidence to physicians on either outcomes or cost. If you don't do anything else, they just say, that's nice, dear, and nothing much happens. So that's that one.